As most of you know by now, Jimmy Buffett, musician Jimmy Buffett, passed away last week, and his cause of death was a type of skin cancer. But it may be a type of skin cancer you've never heard of. It was called a Merkel Cell carcinoma, and we're going to talk about that today. I'm Dr. Wolf, and if you're interested in topics related to cancer, pathology, forensics, medicine in general, or infectious disease, please consider following the page. So skin cancer, the most common types are going to be squamous cell carcinoma, basal cell carcinoma, and of course, melanoma. Now, I'm going to go over where these arise, and we're going to put that in context with the Merkel cell itself because it's different. Merkel cell is much more rare. Most people getting a skin cancer, it's going to arise from this area, which is the epidermis. This is the top or outer layer of the skin. And this is where the squamous cell carcinomas and the basal cell carcinomas arise from cells down here. And then you have the melanoma, which are from melanocytes. So those are the pigmented cells. But this is a different type of cell. So this little reddish, spiky looking cell that they've depicted here in this drawing, this is the Merkel cell. And this is named after Dr. Friedrich Merkel. And basically, this is known as a neuroendocrine type cell. So it's kind of like a neural cell that also produces hormones. Similarly, if you've heard of small cell carcinoma of the lung, that's one type of neuroendocrine tumor, except this one occurs in the skin. So Merkel cell can be an aggressive cancer, just like melanoma can be an aggressive cancer. It's more worrisome than the basal cell or the squamous cell carcinoma, which tend to be a little more limited to growth to their local area. So when these cells become cancerous, what do they look like on the skin? Now, as you can see, I took this image from merkelcell.org, and much of the information in this TikTok is from merkelcell.org, and also a skin pathology book by David Whedon, which I will show you in just a few moments. So as you can see, it's just a reddish nodule on the hand. It looks a little ulcerated. This one is one on the lower leg, and as you can see, it's kind of dome-shaped and pink, not ulcerated. And then you've got this one, which is in the ear and looking quite large and polypoid. I think this one was thought to be a squamous cell carcinoma, which would be more common. Okay, so what do these look like under the microscope? All right, we've got the skin pathology book here. This book actually has like 1,000 pages in it, but we're going to go to the page that involves the Merkel cell. So you don't really have to know a ton about histology and microscopic examination to know that this is bad. And I'm telling you this, when you look under the microscope and you see sheets of dark purple cells that are invading the tissue, that is a very bad thing, regardless if you're looking at the skin or something else. And so what you see here, these are all malignant Merkel cells, and they are growing out of control. And as they invade, they're able to get access to things like blood vessels and lymphatic vessels, which allow it to spread distantly. Now, we can look at those previous images, and as pathologists, we know this is a good chance it's a Merkel cell, but we can do an immunohistochemical stain for cytokeratin, CK20, and we see this dot-like positivity. And when we see this, we feel very strongly that this is the diagnosis of Merkel cell carcinoma. All right, so what causes Merkel cell carcinoma? Well, there are associations with older age, tend to be males in their 70s most commonly, tend to have fair skin, and there is an association with sun. Remember, association and cause are not exactly the same thing because I personally have diagnosed multiple Merkel cell carcinomas, some of which were not on sun-exposed skin. And so there may be an association when you think about fair-skinned people. A lot of them do occur on the arms and on the face, which tend to be sun-exposed. So there is a possible association there. But there's also an association with, as you can see behind me, Merkel cell polyoma virus. And so I'm going to get out of the way, and you can just skim through that and see that they tested tumors, and they found in 8 of the 10 tumors there was DNA or genetic material that was consistent with the polyoma virus. So once again, this is an example of a cancer which may be caused by viruses. This is something we learn more and more about as the years go by. These tumors do tend to be aggressive. They can spread widely and they can cause death. Unfortunately, this is what happened to Jimmy Buffett, but strangely, there are reports of these tumors that can undergo regression, which means they just go away. Now, if it were me, I wouldn't rely on that. If I got the diagnosis of a Merkel cell carcinoma, I would definitely want whatever tissue nearby was excised. But sometimes those cells can get out into the bloodstream and the lymphatic system, and they can spread, and it's kind of too late. As far as prevention goes, how do you actually prevent a Merkel cell polyomavirus? Probably we can't really know that information because viruses are so pervasive. But in terms of the possible sun association, just like with melanoma, basal cell carcinoma, and squamous cell carcinoma, limit sun exposure, use sunscreen. And I also want to stress that if you look at your skin and you compare something on your skin to the images that I showed, this does not mean they are Merkel cell carcinomas. Those images I showed can also look like squamous cells, they can also look like basal cells, and they can look like other things that are none of the three things that I just mentioned. So if you have concern about a skin lesion, go see your doctor, go see your dermatologist.